Recently, the Washington Post reported that the Trump administration had asked the Centers for Disease Control and Prevention, our nation's public health agency, to not include 7 really powerful words in their upcoming budget requests. And those words include vulnerable, entitlement, transgender, fetus, science-based, evidence-based, and diversity. We don't know whether this is coming directly from the White House, whether this came from the Department of Health and Human Services, whether this came from the Office of Management and Budget. But regardless, if you're asking the CDC budget staff, who are really looking at trends in public health and making their best suggestions for where money should be allocated, where scarce resources should be allocated, to say don't include any transgender population in our public health services, that's really mind-boggling. The federal government's role in advancing science and public health is important, because if it wasn't for all the agencies under the Department of Health and Human Services, like the Centers for Disease Control, like the National Institutes of Health, then we wouldn't have all the advances we have today. Now, how much role should the White House have in indicating the agendas for those agencies? Very little. They're not public health officials. They're not scientists. They should rely on the people that they've nominated to lead those agencies to make the best decisions that can serve the American public.